Assistant client with controlled coughing and deep breathing. Count respiratory rate and assess depth and chest expansions. Isolate the patient's lungs. Assess the individual's activity pattern. Identify whether the patient is at risk for respiratory system. Respiratory problems. Check the client for pain or other factors. Plan for relief pain. Plan for appropriate and frequency for the procedure. For implementation, wash your hands. Explain the purpose to your patient. Hi, Mr. Lee. I'm doing the controlled coughing and deep breathing procedure to you. This will help you improve your respiratory functions. Place the patient into the sitting position. Splint the chest and abdomen with pillow if necessary. Have the patient deep breathe for 3 times. Inhale, exhale, inhale, exhale, inhale, and exhale. After the third deep breath, have the patient inspire and hold the breath for 3 seconds. Okay, inhale. Okay, and exhale. Have the patient expire forcefully against the closed glottis and then release the air abruptly while flexing forward. Check the lungs by auscultation. Offer oral hygiene. Mr. Lee, do you want to brush your teeth or do you want to have a mouthwash? Repeat deep breathing and coughing orally as needed to clear the lungs of secretions as ordered. Evaluate the following. Respiratory rate equal or less than the rate before the procedure. Chest expansion equal to or greater than before the procedure. Lungs clear to auscultations. Patient resting comfortably. Document the patient response in the patient's chart. Watch out for any untoward reaction such as dizziness, tachypnea, and tachycardia.